Welcome to 10 questions and 10 answers in your health problems. We have very special guest today. His name is Professor Sezai Leventoğlu. He is actually chief of the proctology and somatotherapy and also endoscopy and colonoscopy unit in Gazi University. And also he is a member of an executive committee in Turkish Colorectal Society. And lastly, but very important actually position again, he is the member of European Coloproctology Society's Dissemination Committee. So he will answer 10 questions about the colorectal cancer today. Okay, welcome to our program, Professor Leventoğlu.
Thank you. Thank you for your kind invitation, Dr. Şenköylü.
It's our pleasure, actually. Let's start our questions. The first question will be, what is the meaning of colon and rectum?
Yes, important question, this colon and rectum. Colorectal cancer is colon and rectum, and both of these organs are in the lower portion of digestive disease system. The rectum is at end of the colon.
Yeah, but another important thing is I think this March, this month, I mean the March is have some specific relation between these organs, right?
Yeah, really. And it's March days is Awareness Colorectal Month. March month marks Colorectal Cancer Awareness Month and month dedicated raising awareness about colorectal cancer in Turkey and around the world. During Colorectal Cancer Awareness Month in March, you can easily help support Colorectal Cancer Society and our patients by organizing Days in Blue Day at your work place on Friday, March 19. And by dressing in Blue Day, raising funds for important Colorectal Cancer Society programs, you will be spreading awareness of disease, supporting patients and their families and helping them face the daily activities challenge of disease.
Great. That means the March is an awareness month for the colorectal cancer.
Yeah.
Cancer. Great. Our second question will be, sometimes people thinks that there is nothing to do after getting a colorectal cancer. So is that a myth or a true?
Yeah, not a myth. It's really true because in a few person now that colorectal cancer may be preventable. And what is this? A low fat diet, high in vegetables and fruit, and exercise may reduce your risk of developing this disease. Since most colorectal cancer from non-cancerous polyps, screening methods can detect and remove polyps before they become cancerous.
Okay. Then we still may have something to do after getting cancer in brief. The third question will be, what causes colorectal cancer? What are the etiologies?
Yeah, etiologies is different factors and may include in non-unknowns that exact cause colorectal cancer. Aging, older person, never too young, and is 45 years old, less than maybe years old. And colorectal polyps and family stories of colorectal cancer. First degree relative person, maybe parents, children, sister, brothers, and person. Genetic alteration and ulcerative colitis and Crohn's disease. Such as ulcerative colitis risk factors and 5 to 15-fold risk. And the other risk factors, lifestyle-related risk factors, diet and cigarette smokes. Diet is important. Maybe it's a processed meat, high in consumption, animal fat. And it's very, very important. The other risk factors, alcohol is consumption and obesity, body weight is high. And the other problem, sedentary lifestyle and the individuals who are not very physically active and high risk. And other problems and diabetes. Diabetes is important, the other cause, colorectal cancer.
I see. Actually, I have many patients from Africa, so they actually specifically consume too much meat. They like to eat meat, and I think they don't consume too much fiber. Is there real big risk factor for the colorectal cancer?
Yeah, really a risk factor because in this high fiber is colorectal cancer is decreased and low fiber in diet and is a higher risk factor colorectal cancer.
I see. Our fourth question will be: does colorectal cancer cause death?
Really, colorectal cancer is curable when detected early. Early staging is important. 90% of patients with localized colorectal cancer are alive 5 years after diagnosis and after diagnosis early stage. And the other, but only 40% and remaining this other person of colorectal cancer are diagnosed at this stage. And remaining patients come to the doctor when the disease had advanced stage as very, very late disease.
I see. Our fifth question will be: is the screening possible for the detecting the disease and for the prevention?
It's an important question because screening is crucial. Because since in early colorectal cancer often has no symptoms, it's important to obtain regular screenings to detect these cancers. Screening is checking for cancer person with no symptoms. And men and women and both sex who are 45 years or older should get screened regularly for colorectal cancer.
Great. And then if a patient, if an individual is older than 45 years old, they should be screened regularly, right? In 5 years or every 2 years, or are there any specific?
Yeah, specifically in a 5 years period in his colonoscopy or the other screening methods.
Is enough. Okay. The sixth question will be: is the family history the only risk factor, or we may have some different kind of risk factors as well?
Yeah, really, another risk factors on not only family history, but also about 75% of new case colorectal cancer occur individuals with known risk factors of disease. A family history just means you may need to start your screening earlier or do more frequently. A personal family history of colorectal cancer or polyps and or inflammatory bowel disease, Crohn's disease or ulcerative colitis, and might need to be screened before age 45. And in addition, women who have personal family history and gynecologic malignancy, ovarian cancer or endometrial cancer or breast cancer may need to be screened before age 45. Talk to your colorectal surgeon about when you should be screening.
I see. And then very interesting information actually, if you have different kind of cancers and you need to be also screened for the colorectal cancer as well. Very interesting information. And another interesting information in this answer is if you have a family history, then you would you should be actually screened regularly by a colorectal surgeon.
Yeah,
right?
okay.
This is very important information for our audience. The seventh question will be: what are the signs and symptoms of the colorectal cancer?
This important situation is and question. Very other symptoms of colorectal cancer and having diarrhea or constipation, feeling that your bowel does not empty completely, finding blood stool in red bright red or dark, very dark stool, and finding your stools are narrower than usual, and frequently having gas and abdominal cramps and feeling full bloated and losing weight with no known reason, and fatigue, having nausea and vomiting. And it's important these colorectal cancer symptoms maybe is losing weight and no known reason and important factor.
Oh, interesting. If I'm correct, the weight loss without any cause is important for any cancer, right?
Yeah, okay.
And they need to be actually screened for this. What about the hemorrhoid and anal fissura? Is that also a kind of symptom or sign of a rectal or colon cancer?
Yeah, similarly, colorectal cancer in causes maybe it's bright red stool in your stool or defecation habitual defecation disorders and bowel movement and loose stool or in calibrating and loose and calibrating in the teen and is maybe colorectal cancer is causes hemorrhoidal disease.
I see. The eighth question will be, how is the colorectal cancer diagnosed?
Diagnosis is simple. Maybe it's a fecal testing, and you may undergo fecal testing every 1-2 years. And fecal test you use it to detect hidden blood in your stool, and it's very important. It is quickly and simple and easy and cheap. Yeah, cheap. And the other methods, colonoscopy. Colonoscopy procedure not painful, and patients are sedated during the procedure minimized and any discomfort. And the other methods and radiologic imaging and MRI and tomography and endoanal and endorectal ultrasound for rectal cancer and other virtual colonoscopy and non-invasive methods. Many radiologic programs in colorectal cancer diagnosis in is used.
I think one of the best the method for this is colonoscopy, right? Because if you need, you can take some biopsy and send it to pathology, and you can easily see which kind of cancer is that.
Yeah, best of is colonoscopy because it is both in biopsy and biopsy the sign is colorectal cancer.
I see. Our ninth question will be, what is the optimal and the best combination treatment for the colorectal cancer?
Best optimum treatment is surgery, but if these polyps are detected and removed before this progression, and colon cancer being prevented, and it's important. Only if this polyps is removed, it's important. Is question is no question is colorectal cancer is absolutely solve the problem. The mainstay of the treatment is surgery, and the choice of treatment depends mainly on the location of the tumor of the colon stage of disease and chemotherapy and for radiotherapy for rectal cancer and minimal invasive therapy and robotic surgery, laparoscopic surgery, and open surgery. Many recently in transanal endoscopic operation and is a popular surgery program. When colon cancer diagnosed at late stage, chemotherapy may be given. It's the only treatment or prior to surgery. Is important, and chemotherapy best of choose in is before the surgery.
But it's important for type of the cancer, right? If some cancer types is resistant to the chemotherapy or radiotherapy, some of them is sensitive, and so you generally use in every patient chemotherapy or radiotherapy, or sometimes you use.
Only colon cancer is chemotherapy and not radiotherapy. And radiotherapy is for rectal cancer.
I see.
Colon cancer chemotherapy is not only in early stage, maybe in late stage, advanced stage. Advanced stage maybe in first option chemotherapy and liver or lung metastasis.
I see. If they have a kind of other internal metastasis like liver or lung, and then they need to go for chemotherapy. Maybe the surgery is not appropriate for this kind of patient because too late, right? That means the early diagnosis is very important for cure and the best or optimal treatment method. Okay, great. Our last question and 10th question will be what are the risks for the surgery?
Yeah, surgery for colon cancer is very safe, with survival in the immediate period after surgery of over 95%. And complications are somewhat minor, more common, occurring in 1 in 5 patients. This can range from minor infections to condition requiring repeat surgery and prolonged hospital stays.
I see. And within this actually question, I just want to ask a question about the surgical method. You already mentioned that robotic surgery and
Yeah,
laparoscopy. Is this a crucial for a treatment, or have some kind of advantages in order to, over the open surgery? What do you think about this?
Yeah, really, in the robotic or laparoscopic surgery, a minimal invasive surgery, because in the length of stay in low and hospital stay, and many is social activity is quickly, and open surgery is made this advantage, and is incisional hernia or wound infection, the long hospital stay. I'm not best option is laparoscopic or robotic. Maybe in individual personal treatment is open surgery or minimal invasive surgery.
I see. It depends of the
Depends on
patient's
patient.
situation. Yes. Would you like to tell something, just for the summary, would you like to tell something about the colorectal cancer?
Yeah, colon cancer is a common malignancy and that causes significant number of deaths. And however, it's potentially preventable through screening. It's important and highly curable with surgery alone when diagnosed at early stage. And modern chemotherapy and continues to improve survival and for patients with more advanced stages. And the symptoms of colorectal cancers are works on thus require evaluation by healthcare professionals. Colon cancer treatment often requires a team of expert physicians and including colorectal surgeons and medical oncologists and radiation oncologists and radiologists and pathologists. And these doctors and multidisciplinary team work with the patient to create the safest and most effective therapy plan. And yeah.
Great, thank you, thank you. Actually, as we all see that the colorectal cancer, the preventable disease, and also early diagnosis is important for a cure or fully treatment of the disease. And actually, I would like to thank to Professor Leventoğlu for his actually great contribution to our program. Actually, his answers are very much appreciated. And please stay safe until the next program.
Thank you.